Buckthall, and today my presentation will be about nurse to aide communication. So my introduction, the problem I'll be talking about today is obviously the communication between the nurses and aides in the workplace. There are no protocols currently at a magnet hospital in the Midwest. So there's vital information that is being missed when nurses are having their own handoff, and then the aides are having their own handoff. So communication is the third leading cause of sentinel events, and this is a major problem that I'll get into in a minute. So what is the solution to decrease these patient errors? Some of the solutions that I have found through research are that a standardized handoff method for communication for each patient information provides a decrease in patient errors. And the second is education for all staff members to stress the importance of these patient errors, as well as how to improve small portions of these report sheets to improve the safety of the patients. So my credibility statement is I'm a nurse on an ICU unit. I've been there for about 2 years, so I've been an RN for 2 years as well. So my problem statement, ineffective communication is one of the leading causes for sentinel events involving medical errors and patient safety. Information is being lost when it is being passed off from one person to another. This is leaving a large margin for error when information is being missed inconsistently with the handoffs. And then ineffective communication was responsible for 30% of all malpractice claims in 5 years. And then in those 5 years, it resulted in 1,744 deaths, as well as $1.7 billion for those malpractice claims. So a simple standardized handoff, detailed report sheet can decrease these errors that are causing those patient deaths. So my literature review, I'm going to go over these 5 articles to tell you how they integrate into my paper. So the first one is changes in medical errors after implementation of a handoff program. So the purpose of this one is to improve handoffs, to improve the patient safety. So a mnemonic was developed, was the IPASS system. It is illness, severity, patient safety, action list, situation awareness, contingency plans, and synthesis by receiver. Other interventions included a 1-hour role-playing and simulation sessions, a computer module, a facility development program, direct observation tools, and process change and culture changes program. So this extra interventions provided education that could be a solution to these errors, and it'll help the nurses and nursing aides adapt to this new standardized handoff method. And then so the results of this study was medical errors decreased by 23% and a rate of preventable adverse effects decreased by 30%. The second one is a standardized shift handoff protocol improving nurses' safe practice in intensive care units. So the purpose was to change the nurses' handover behavior. It called for a 3-step intervention: the unfreezing, the change, and refreezing. So the unfreezing step is in place to break down the resistance to change. The change step is there to promote the new standardized method. And the refreezing step is when the hospital will attempt to prevent the employees from readapting to their old behaviors. So the results from this study is 5.4 point increase in safe practice evaluation checklist. The third one is continuing nursing education, patient handoffs, and nephrology nurse practice settings, a safety study. So this purpose was to evaluate the process of how information is being exchanged between staff members, as well as time required for handoff and the use of standard procedures for handoff. So they're looking at the environment in which the nurses are giving their handoffs. The study used a socio-demographic information for a 50-patient handoff tool items and 2 open-ended questions. So from this study, they found that if they recommend the SBAR method, it is situation, background, assessment, and recommendation. The IPASS that I had said before in the previous article, the 5 Ps, which is patient, plan, purpose of plan, precautions, and problems. So the results is the environment in which this handoff is given is fast-paced, loud, and chaotic usually. So that's, if we have one standardized method, that will help decrease those errors that we are getting pulled off when it's chaotic. The fourth one is communication elements supporting patient safety and psychiatric inpatient care. So the purpose is to improve multidisciplinary development of communication, and shared written documentation, reporting, and handover should be created across the unit, and health policies updated for patient safety. So the implications they had were fluent information transfer, open communication, and active communication. So the fluent information transfer would be accurate documentation and its use. Open communication to keep patients safe, and active communication would be for staff members to realize their role in the communication. And the last article would be developing, implementing, and evaluation of diabetes care training for nurses and nursing aides in nursing homes and municipal home-based services. So the purpose is to evaluate an educational training program for nurses and patient care technicians in municipal home-based services. Their implications were to provide an educational program yearly for the staff members. So there were 16 registered nurses and 4 patient care technicians that attended a conference. After that conference, they had a educational program. And so the results were that the staff had more education on the topic, professional confidence in proper treatment, and knowing how to handle challenges in the workplace. So my PICO question for my paper were for the population were obviously the patients in the hospital, since they're the ones having the brunt end of the patient errors. Intervention, or implement a standardized handoff communication process before the working shift. Comparison is the new intervention, which is that new standardized method, compared to the current practice, which was every nurse or nursing aide had their own method of handoffs at the Magnet Hospital in the Midwest. The outcome is increase in patient safety and decrease in patient errors with communication errors. So theoretical framework. I chose Roy's adaptation model, so it incorporates family, education, religious background, mentor, and clinical experience influenced in this model. The key concepts are health, environment, and nursing. Roy's adaptation model was developed with the goal to promote adaptation to change in the nursing field. Then how does this apply to the nurse-aide communication? Improving communication will take a lot of adaptation to change from the staff members of the hospital for this new standardized handoff method. So the design, setting, and sample. This was a quantitative experimental research study. It reveals how many patient errors occurred before the standardized handoff method and how many occurred after. I chose to do a 6-month study that would have 100 patients total. 50 would be for the control group and 50 for the experimental group. The experimental group would have the nurses and nursing assistants use this new standardized handoff method. The control group would be that those nurses and assistants, they use their own standardized method that they used before this. And then in the 6-month period, all of the patient errors that occurred from communication errors would be reported to the Joint Commission as well as the research study. The results that were reported would be compared to the results that occurred at the hospital before the research started. So you would have the results for both of them. This would show if the standardized handoff method decreased patient errors or not. And at the end of the 6-month period, the staff members would also take 2 post-tests. One would be an open-ended question survey, and the other one would be a post-test that scored their answers to get a qualitative data. So data collection and data analysis. The independent t-test would be used to test the hypothesis that a standardized handoff method would decrease the incidence of communication-associated patient errors. So I have 2 appendixes. One is A, and that is the open-ended question survey that I'll show you on the next slide. And B is the 3-point question survey that I used to score those results. And these results are calculation results of these tests would be used determining the SPSS software. And I would use the results submitted to the Joint Commission before and after the study. You would be able to compare if there were fewer patient errors due to communication after the study than before. So Appendix A and B. B, I would use the 1, 2, 3 for each question, and then the lower the number, the better the standardized handoff is at decreasing patient errors due to communication errors. In conclusion, nurse to nursing assistant communication is very important to ensure quality patient outcomes. So if communication is decreased, then patient falls or even death can result. A standardized handoff method is one way to help improve patient outcomes, and this topic would benefit from further research to keep patients safer and provide quality care. Thanks.